Dr. Zamorano, are there ways to prevent cervical cancer?
There are ways to prevent cervical cancer. This is one of the really exciting things about cervical cancer in general is that we have not only great treatments, but we also have ways of preventing the cancer from ever occurring. So one of those is through cervical cancer screening. Cervical cancer screening is important because it gives us the opportunity to diagnose and treat precancers to keep them from ever becoming a cervical cancer. The other great way of preventing cervical cancer is with the HPV vaccine, or the vaccine for the human papillomavirus. This is a vaccine that can be given to individuals, both boys and girls, as early as age 9, and has really done remarkable things around the world to decrease the prevalence of HPV and also to decrease the incidence of cervical cancers. HPV is linked and causes most cervical cancers, as well as many other cancers of the genital tract and also the oropharyngeal or mouth and throat tract. The HPV vaccine has been really remarkable because it not only will decrease that individual's risk of obtaining a high-risk strain of HPV, but also decreases their ability to have a high-risk strain and then spread it to others. HPV is a sexually transmitted disease, but the way I discuss it with my patients is that it's not an STD like they might traditionally think of. It's one that is not tested and then treated like many others, but it is many times actually managed by our body's own immune system and treated by our body's own immune system. But sometimes patients acquire a high-risk strain of HPV that lingers, that our bodies are not able to get rid of. And it's these high-risk strains that linger that can cause cell changes that can lead to precancer and cancer, such as cancer of the cervix. So my activation tip for this question is to not only think about cervical cancer treatment, but also cervical cancer prevention. That one of the things that I speak to my patients about, because they always ask me what they can do for themselves and then also their family and friends, is to talk about cervical cancer screening with them, to talk about the HPV vaccine with them, to encourage them to have their family and friends, their children vaccinated, go through screening so that we can try to prevent as many cervical cancers as possible.
There are some guidelines for when the HPV vaccine should be given. Is there a maximum age for the HPV vaccine?
So the maximum age is listed as 45. This is in conversation with a physician. So the set maximum age is 26. However, it can be given between the ages of 26 and 45 after a conversation between the patient and the provider. This is typically a good idea, but it's always important to have this shared decision making.